Hi, I'm Dr. Jyoti Patel, and today we're talking about the doctor-patient relationship in addiction and substance abuse. The doctor-patient relationship is a beautiful bond, and it's based on mutual trust, respect, and a desire from both parties to engage in healing. But in addiction and in substance abuse, this relationship becomes complicated. Patients may enter the exam room with feelings of being judged, shame, guilt, and even anger towards the people that they've come to for help. And doctors may go on the defensive. They may choose a more passive-aggressive approach, avoidance, maybe even referrals. And part of that comes from a lack of education on how to treat patients with chronic substance abuses. Also, maybe lack of resources, and the doctor may have a feeling of being manipulated by their patient. So how do we mend this gap? How do we create this bond of trust, mutual respect, and a desire to heal back again in addiction? First, I'm going to address doctors. So there are 5 things that I'm going to ask you to consider. First is compassion. Being compassionate is important, but it also is not a guarantee that you're going to write for that prescription. So there is no reason not to be compassionate. Letting the patient know that you are present and that you're there for them is something that we do with every patient, and should do that also with patients with substance abuse and addiction. Number 2, be a good listener. Listening to the patient's story and hearing them is also not a guarantee that you're writing for that prescription. So pause, breathe, ground yourself, and really listen to your patient. You do that with patients who have cancer. You do that with patients who have chronic disease. Why not with patients who have substance abuse issues or addiction? Number 3, let the patient know that maybe it's outside of the scope of your practice, so share your lack of knowledge. Let the patient know that maybe their problem is more complicated than you feel comfortable treating. So allowing the patient to know that this is outside of your scope of practice is sharing with them something that might be your vulnerability, and it's okay to do so. It's not a license to say that you don't know what you're doing. It's just that in this particular matter, maybe you are not well educated to help them. 4, educate yourself with who may be the right people to help in your community. So generate resources that you can give your patients, and not just turf them off to somebody you don't know, but people that you have closely worked with, that the patient knows that you're sending them to somebody you trust. And then take continuing medical education. If you are a primary care physician or a physician that sees a lot of pain patients, educate yourself on how you can handle patients that come to your practice. So getting continuing medical education can also be a place where you can help your patients. And lastly, be present. Let the patient know that you are willing to follow up with them frequently. And following up with them frequently means that you care about them, that you want to see if there's other things that you guys can work on to help them away from this addiction and away from substances that maybe are harmful for them. Comply with things like screening tools. These may give you insight into what other things that may be going on with the patient, compounding their problem, whether it's depression, anxiety, or social stressors. Use your urine drug screens. Make sure that you're safely administering your prescriptions to your patients. Let the patient know that you're doing it because you care. And frequent follow-ups will give you a chance to explore other alternatives, maybe even outside of medicine, that can help the patient become healthier without those substances. And this could include counselors, acupuncture, massage therapists, touch therapists, talk therapy, anything. Even group therapy can sometimes help patients. So expand your knowledge of the resources in your community, and let the patient know at their regular follow-ups that you've done research to help them. This is going to give them the idea that you are there for them. So patients, what can you do? First, breathe. Before you start your journey to the clinic, take a deep breath and say words of affirmation. You have a chronic disease and you deserve care just like everyone else. 2, when you enter the office and go to the front desk or interact with the medical assistant or the physician, be patient and be kind. A lot of times when we come in with anger, it automatically puts the other person on defensive. And if we fake happiness or we fake friendliness, that also can sometimes put the other person in an uncomfortable position because they feel that sense of fakeness and it puts them on defensive again. So be genuine, be kind, and be patient. You will get a response from your care provider if they know that you are genuinely present to be helped. Be open. Go in with an attitude that you're open to all possibilities, and understand that there may be other alternatives that you haven't tried yet that might help you with the addiction and help you off of these substances. Let the physician or provider know if you have tried other things and what's helped and what hasn't. Giving them more information will only help them be better. Getting frustrated that they should already know this about you is sometimes unreasonable, because your provider may have hundreds of other patients and have not kept up with your past visits. So be certain to re-explain to them what you've tried, where you've been, and what's helped. Comply. If they ask you to do a urine drug screen or they ask you to come in more frequently, be open to those possibilities as well, because they're doing that not only to be compliant with maybe federal laws, but also to keep you safe. So be open to those ideas that your doctor or your provider is recommending. Come in when they ask you to. Tell them what's worked, what isn't, and also share with them if you do have other psychosocial issues. You suffer from depression, you suffer from anxiety, you have other addictions, or your family has a history of addiction. These are all things that might be relevant. You're dealing with stressors about your own health or health of a family member. You're dealing with financial issues. You're dealing with stressors with your marriage or your work, or you find yourself having difficulty with nutrition or movement or sleep. Let your physician know. Share with them these other factors that can help them put together a better treatment package for you, so that you can also work towards removing yourself from addiction and substance use. So that's it for patient-doctor relationships and how to mend them from both the doctor side and the patient side. I hope this was helpful. Please share with anyone who can benefit. I'm Dr. Jyoti Patel. Follow me on Facebook, Instagram, and Twitter. Till next time.